Good afternoon and welcome to our webinar, From Screening to Support, Strengthening Nutrition Access for Older Adult Caregivers. I'm Chelsea Gilchrist, and I am Director of Partnerships and Business Development at TCare, and I am delighted to share our presenters today. Bob Blancato is the president of Matz Blancato and Associates in Washington, D.C. He is recognized as a national policy advocate for older adults and has testified on numerous occasions before Senate and House committees and federal agencies. He serves as the executive director of the National Association of Nutrition and Aging Services Programs, national coordinator of the Elder Justice Coalition, and the national coordinator for Defeat Malnutrition Today Coalition. He is a champion in the aging and nutrition space. Laura Borth is the policy director at Matz Blancato and Associates, supporting the National Association of Nutrition and Aging Services Programs, the Elder Justice Coalition, and Defeat Malnutrition Today. A registered dietitian with over a decade of experience in the nutrition field, she holds an MS in Nutritional Sciences from the University of Wisconsin-Madison. We're delighted to have you join us today, Laura. And last but certainly not least, Diane is the President and Chief Executive Officer of Age Options. Diane has served with the agency since 1976. She's the President of the Illinois Association of Area Agencies on Aging and the co-chair of the Legislative Committee. She also serves as a board member for U.S. Aging. She is known for her advocacy efforts to establish new programs to serve older adults and being an innovative, collaborative leader. And a bit about my background, I am a gerontologist, and I've spent my career driving innovation in public health and aging, advancing programs and partnerships that improve the lives of older adults, caregivers, and the communities that support them. A brief overview of today's agenda. We'll be starting with opening remarks, followed by some information of the older adult caregiver landscape, older adults and nutrition, and sharing best practices in action, a community model. We'll end today's webinar with a brief question and answer session. So without further ado, I'll turn it over to Bob Blancato for opening remarks.
Thank you, Chelsea, and on behalf of NANAS, welcome to today's webinar. We are delighted to be partnering with our friends from TCare and Age Options. Anyone who is joining us today knows the importance of nutrition, especially as it relates to health. What we also need to realize, and we'll learn more today, is the integral role nutrition plays in the caregiving experience. Ensuring that both the caregiver and the person receiving care have good nutrition as part of a caregiving plan is absolutely essential. NANAS works in the center of advocacy for adequate funding for older adult nutrition, whether it's through the Older Americans Act, the SNAP program, Commodity Supplemental Food Program, or the Senior Farmers Market. We're also heartened by the growing emphasis of good nutrition in the Make America Healthy Again effort. But connecting successful caregiving with nutrition is an effort we need to continue to grow. So now it's my pleasure to turn the program back to Chelsea. Thank you very much.
Thank you so much, Bob. Next slide, please. So for this, first, for any of those who are joining us today and less familiar with TCare, a little bit about our history. We are an evidence-based caregiver support and assessment program created to identify and mitigate the risk of caregiver behavior that leads to burnout. Our research spans all the way back from 2007 when we were created at the University of Wisconsin by Dr. Rhonda Montgomery. She devoted 35 plus years of her career to evaluating and reducing caregiver burnout. This research then built the protocol that we have used with 33,000 caregivers all over the nation. In 2014, TCare became an Administration for Community Living accredited family caregiver support program. And in 2017 is when we took it to scale. And today, 15 plus years of history and experience supporting caregivers across the spectrum, caring for care recipients across the spectrum as well. We have been published in over 90 peer-reviewed publications as well. Next slide, please. A little bit about our model. We are focused on identifying, stratifying, and mitigating caregiver burnout risk. We provide caregivers with the right resources at the right time and reduce the impact and prevalence of caregiver burnout and recipient placement in institutional care. Next slide, please. So we understand that there's, of course, a significant risk for structure and coordinated care for older adult caregivers. I wanted to start with a brief snapshot of who our older adult caregivers in the US are. The prevalence: over 1 in 5 adults age 60 and older are caregivers for an adult or a child. 53% are caring for a spouse, and 32% are caring for a parent. A majority of these caregivers are female, as well as retired, where about 14% are working full time. And we know too that these older adult caregivers are managing their own complex health conditions. More than half report having 2 or more chronic conditions. So the question then becomes, how do we consistently identify which caregivers are at highest risk and intervene before a crisis occurs? At TCare, this is our process and approach to doing so. We start by providing a screener questions that identify the caregiver's burden scores, again, grounded in our research of the key burdens that need to be identified to be able to stratify their risk. These include identity discrepancy, stress, relationship, objective burden, uplifts, so the positive, meaningful moments that a caregiver experiences in their journey, and the caregiver's risk of depression. At this initial point, we also measure the caregiver's intention to place their care recipient in an institutionalized facility. And once we've gathered this information, we use a complex, high-tech powered AI-driven algorithm that stratifies this risk and identifies the caregiver's greatest priorities and needs so that we can deliver that right resource at the right time, which takes us to the caregiver action plan. Phase 2, we create those goals to improve caregiver well-being and, of course, work with them in delivering that well-being plan that captures the resources they need and the referrals they need. And last but not least, it is very important, of course, because our caregivers' needs are ever evolving, that we consistently follow up with them. So a key part of our approach to assessment and follow through is making sure we have those 30, 60, and or 90-day follow-ups at a minimum. So next, I'll share just again a brief snapshot of what our data has shown to date of the greatest challenges among older adult caregivers who are at risk of food insecurity. So as I'm sure most on this call are not surprised to see, a majority of these caregivers, or nearly all, are at risk of depression. All or nearly all struggle with relationship challenges, stress burden, objective burden, which includes financial and structural challenges, legal challenges, access to medical care, and identity discrepancy. So next, I want to roll into Laura's presentation to share more about how we can address the significant stressors that caregivers that are at risk of food insecurity are facing.
Yeah, all right. Thank you, Chelsea. So, as you are all well aware, the older adult population is increasing. And by 2060, almost 90 million Americans will be 65 years and older. And what we're, thinking about with this population is how we can get good nutrition. Healthy aging starts with good nutrition. Next slide. So this might be obvious, but I think it's always good to remember that um, good nutrition is at the core of supporting healthy aging, preventing the risk of falls, and all of those things that we need to support independence and being able to live the way that we would like to live. And then on the flip side, malnutrition leads to poor health outcomes and can lead to frailty and disability. Next slide. Just some definitions. Food insecurity is having limited or uncertain access to food. Hunger is a physiological condition, and then malnutrition is an inadequate intake of nutrients. This could be calories, proteins, vitamins, minerals. It can happen with people with obesity, chronic diseases. Medications can lead to it. So there's a lot of causes that can cause malnutrition. Next slide. So malnutrition is a growing issue affecting older adults, especially the oldest old. So this top graph is malnutrition-related hospital stays, and you can see that compared to those under the age of 60, the 65 to 85, and especially above 85, really malnutrition is related to how often they are in the hospital. Up to 1 in 2 older adults is at risk of becoming malnourished. We actually don't have a great amount of data on how many older adults are malnourished in America, but I'll get to some of the data that we do have. And malnutrition in older adults is estimated to cost over $51 billion annually. And this is actually an old number. So if this were adjusted for inflation, that would be $71 billion a year. That's the cost of disease-associated malnutrition. So not even every type of malnutrition. Those with malnutrition who end up in the hospital are 3 times more likely to end their hospital stay in death, and their hospital stays are often 2 times longer. Next slide. I was part of a research group that looked at malnutrition and food insecurity in an annual survey of Older Americans Act participants. And if you look at this, almost every program, and this includes caregivers, both the caregivers themselves and those older adults they care for, about 20% of people were screening positive for malnutrition risk, which doesn't mean they have malnutrition, but it means that it's like, they should be assessed and someone should dig deeper into that. And then we found a 20% screened positive for food insecurity risk, and that was higher in home delivered meals. And we did find that those receiving home delivered meals for longer were less likely to be at malnutrition versus those who are kind of newly on the program. Next slide. This is just an idea. Anybody can screen for malnutrition. Anyone can screen for food insecurity. It doesn't need to be a nutrition professional because it's what you do with the screening tool that requires the expertise. So this is the malnutrition screening tool, and it is recommended by all the national nutrition organizations because it's so simple. Have you recently lost weight without trying? If yes, how much? Have you been eating poorly because of decreased appetite? Boom. And then you move on. Next screen. Similarly, there's many ways to screen for food insecurity. The USDA in their annual survey that up until recently was an annual survey is 6 to 12 questions. But you can tell a lot by just asking these 2 questions. Are you worried about food running out? Did you have food that didn't last and you didn't have money to get more? Again, if someone screens positive for either of these, the next step is to refer them to help and assistance. Next slide. Many older adults have unmet needs that are risk factors for malnutrition. So food insecurity is a risk factor. 10% of older adults are food insecure. Non-white older adults are much more likely to be food insecure. 10% of older adults live below the poverty level. That's 1 in 5 for Black, Latino, and tribal elders. 1 in 4 live alone. 1 in 5 older adults say they can't function at all or have difficulty with at least one function, but do live in their home still. And chronic disease is also another risk factor for malnutrition. And we know that almost every older adult has at least one chronic condition. Next slide. Purpose of the Older Americans Act Nutrition Program is reducing malnutrition. The intent of this program is to reduce hunger, food insecurity, malnutrition, promote socialization, and promote health and well-being. So it's more than just a meal. All participants are screened for nutrition risk when they enter the nutrition program, and usually annually. And states and area agencies on aging are required to have a plan of how they're going to address malnutrition. Next slide. This is just the screener that the Older Americans Act uses. And what's helpful with this screener is that it identifies a lot of things that we can help with. I don't eat that many fruits and vegetables. Okay, well, we can give you a meal. I have tooth problems. We can refer you to a dentist. I don't have enough money to buy the food I need. Maybe that's a referral to SNAP. So that's something that's happening in the Older Americans Act programs, either at AAA's or meal programs. And then the program acts on all of these risks. Next slide. And then the Older Americans Act talks about targeting programs to those with the greatest need. And those with the greatest need to sign up for our program are at higher risk for malnutrition because it's related to, all of the things that we've seen on those screeners. And we actually know that there's 2.5 million food insecure, low-income older adults who are not on OAA programs. They haven't been identified by case management or, through a T-Care pathway and then referred to an OAA program that they really could benefit from. Next slide. So those in the aging network will always already be really aware of all these ways to connect with older adults. But if you're working for an organization that isn't an ONA program, joining aging coalitions, creating shared referral pathways with aging programs so that older adults can get, don't fall through the cracks as they are going from one organization to the other, and help spread the word about how good OAA programs are. Next slide. And so why should you refer older adults who are at risk for food insecurity and malnutrition to OAA programs? Malnutrition is preventable and treatable. And we want good outcomes for these older adults. Next slide. And then just a note on what OAA programs are set up to provide. Every program has access to a dietitian. These meals are, do follow the dietary guidelines for Americans and the nutrient recommendations for vitamins and minerals. And they have nutrition education, counseling with a dietitian, these regular screening and referral. And then some have, medically tailored meals, grocery box, prescriptions, food is medicine, things that you'll hear from Diane shortly. And then maybe next slide. Yes, of course. How to find your local older adult program. There's an excellent website called the Elder Care Locator. And you just put in an address and you can have all the contact for local aging resources. And with that, I'm going to turn it over to Diane.
Thank you so much. I am so pleased to be invited today. The intersection of caregivers and nutrition is such an important one for us right now at Age Options. We have been advocating for increases in meals programs as well as increases in the caregiver line items. So thanks for allowing me to present with you all today. Next slide. So I'm going to provide you with some information as a national overview, and then we'll go into the state level, and then the local level, just to give you one picture of where things are at with our area agency on aging. So this gives you a brief history. If you don't know, the Older Americans Act history goes all the way back to 1950 with the first national pre-White House Conference on Aging. Bob Blancato, who was on with us earlier, actually chaired the 1995 White House Conference on Aging a number of years ago. So just to give you an intersection there in terms of his role. And then, we just last year celebrated the 60th anniversary of the Older Americans Act, as well as Medicare and Medicaid. So next slide. These are the five service areas that are funded under the Older Americans Act. And I know you can read them for yourself, but a combination of supportive services, nutrition services, and then more recently introduced health promotion and caregiver services. The most recent addition to the Older Americans Act being the caregiver programs. And you could see underneath each of those some of the programs that have been added to complement each of those programs. Next slide. So for the Older Americans Act nutrition programs, I think the most salient feature of this program in terms of eligibility guidelines is the fact that it is not means tested. It has no income guidelines at all. And people who are homebound or generally in need of home delivered meals are eligible, but we also really encourage people to utilize the congregate dining program in cases where it's appropriate. Next slide. So I have 620 colleagues across the nation, and this just gives you a quick image of, I see Missouri there in the middle and Oklahoma. So each area agency, each state has its own borders for area agencies on aging. In the case of Illinois, we have 13 of them, and just varying numbers. New York State has many, many more, and as does California, but you get the idea. It's every state has its own kind of configuration. Next slide. So the state of Illinois has 13 AAAs, and our area is that aqua-colored area surrounding the city of Chicago. And the downstate area agencies, cover in some cases way more geographic territory. But the population in Illinois is in many states is kind of centered around the metropolitan area of Chicago. Next slide. So the Illinois data very much reflects what Chelsea shared earlier in terms of average ages. This data comes from the recent National Alliance for Caregiver and AARP study. This is the Illinois data that they gave. So you could see that average caregiver, once again, is a female caring for somebody 66 years old, just the average picture. Of course, there's many other caregivers to either end of the scale. At the bottom, I think it's really important to pick up on where we looked at earlier in terms of Hannah and Chelsea looking at the financial impact of caregivers. 47% experienced at least one financial impact, such as stopping to save money, but also many other issues. And emotional stress among 40%. So, you could see that this very much reflects the TCARE data, and we'll be taking a deeper look at that in a minute. Next slide. So across Illinois, they might be called by slightly different names, but for the most part, we call them caregiver resource centers that are funded under the Older Americans Act under Title IIIE. So Illinois receives about $6 million in federal funding, and we have also advocated to receive over $5 million in state funding, and that supports these caregiver resource centers throughout the state. And they serve the people that you see in the lavender block there, caregivers of people of any age. Grandparents raising grandchildren has been just a skyrocketing issue in our area in particular. Next slide. So these are the services that for the most part are available throughout the state of Illinois. And I say that because with the loss of the ARPA money, we are in extreme need of additional funding. We don't have nearly enough funding for any of these services, but TCare, as you'll hear in a minute, has really helped us pinpoint the needs that are going to make the biggest difference in the lives of caregivers. It's the only assessment tool that we have that's really aimed at the caregiver. Next slide. So this is just more in depth on our suburban area. I know when I hear presentations by other AAAs, I'm always curious about what their landscape looks like. So our planning and service area surrounds the city of Chicago, as you can see, and includes 130 different separate communities where we serve 607,000 older adults and nearly 250,000 caregivers. What's really been growing in our area is the number of people who are non-English speaking or speak very limited English. Our area has more older adults than 16 states currently, so it's a rather largely populated area. Next slide. So we wanted to include this because you can click on our referral page down there in the left-hand corner and easily locate the caregiver coordinator agency, caregiver resource center for your particular area. So these are the caregiver resource centers that Age Options funds with the federal and state funding. And they really have a deep set of resources in each of their areas to impact the lives of caregivers. And all of them are charged with using the TCare Tailored Care Assessment Tool in order to determine what services are needed by those caregivers. Next slide. So I know Chelsea went into this earlier, but we have been committed to this tool throughout the state of Illinois because it has helped us to develop additional advocacy data that we have used with stories and data to present to our legislators at the state level. It also helps us to really prescribe which services are most appropriate for every single caregiver. We worked with TCare to make it accessible for people speaking Spanish and English, since we do have caregiver resource centers where the staff primarily speak Spanish. So we're very proud of that and very proud of our partnership with TCare for that. Next slide. So long-term implications of using TCare. It's the robust data, as I mentioned earlier, that we collected. It also helps us to reduce caregiver stress, burden, and depression, and reduce hospitalization through all the resources that Laura and Chelsea mentioned earlier about when malnutrition and when stress on caregivers increase, you're also increasing hospitalization stays, emergency room stays, not only for the recipient of the caregiver, but for the caregiver themselves. Next slide. So the TCare process, for the most part throughout the state of Illinois, we provide the intake screener tool on our website, on our State Unit on Aging website, and as publicly as we can through social media throughout the area. So we like to provide that initial screener QR code so that people can log on and screen themselves, and then go through a shortened assessment tool and a more in-depth assessment tool with each of our caregiver resource centers. And then, as Chelsea mentioned earlier, do follow-up assessments on a regular basis so that we can measure our impact on an ongoing basis in terms of each individual caregiver. Next slide. So the data tracking, and we'll look at the data itself in a second, but we're able to look at the number of initial screener tools, the initial assessment, the number of caregivers that we're serving, and then in depth on the demographic data and the clinical data. We're really looking forward to matching this up in the future with actual hospital data. And we have the beginnings, right, Chelsea, of a project in mind to basically take a look at actual healthcare data against the TCare data to show what's happening. And we're excited about that. And we'll probably have another webinar in the future to share that if we're able to do that. Next slide. So our T-Care data at a glance, we're really excited about this. So actually, we've been working with T-Care since about 2019, and we actually got going in 2020, and then spread the use of T-Care throughout the state of Illinois. So we have served over 3,500 caregivers. And similar to national data and statewide data, again, most of our caregivers are females. 63% of them are over the age of 60. And then it's just very much in sync pretty much with our population in terms of the demographic data. We are always trying to do additional outreach in underserved communities and, continue to work on that along with T-Care. 41% of our clients are retired, 30% are still working full-time, and that's a large part of our advocacy is for working caregivers. 13% working part-time and 9% unemployed, some of that because they are caregivers. Next slide. So we'll zoom in just in terms of risk of food security. So as we do the assessments, we're able to focus on the food security of caregivers as well as care recipients, taking both groups into consideration. And overall health rating at intake is something you really want to take a look at, particularly those people, 8% at poor health quality and 27% poor. Sometimes that self-reporting doesn't actually truly reflect how poor their health is. I think some of those self-reports look a little better than what they actually have, or what their actual health status is looking like. Next slide. So zooming in terms of older adult caregivers at risk of food insecurity, this gives you a look at each of the categories in terms of depression, relationship burden, stress burden, and identity discrepancy. And I always like to give a quick description. Identity discrepancy sounds like such a wonky term. But basically, as I cared for my mom, my experience was when I got to the point of not feeling like I was her daughter anymore, my identity switched to sort of like an unpaid paid caregiver, if that makes any sense. You felt more like the person in charge of providing the care rather than her daughter. That's kind of my definition of identity discrepancy, where you lose that feeling of having that caring relative relationship. So the blue lines here show you that the risk for food insecurity and then against all caregivers. So you can kind of see what's happening in terms of the food security compared to caregivers. So when we go through the next slides, we'll start to look at some of the programs that work for both the caregivers and the care recipients. Next slide. So under the Older Americans Act and in suburban Cook County in particular, we provide 5 different programs for people who are at nutrition risk. The Congregate Meals Program, which are provided through every area agency on aging, and which we really try to recommend very highly. Try to guide people towards using those congregate dining programs versus trying to ask for home delivered meals right off the bat, because the socialization is such an important factor in improving the health of all older adults, caregivers, as well as care recipients. Home delivered meals, next, pre-prepared meals that are delivered to the person's home by either volunteers or paid drivers. And then we have added a meal kit program where we provide menus and recipes to clients. And this one is particularly helpful to homebound recipients of care where the caregiver is actually present or can help to prepare the meals. So those meal kits are especially desirous to people who are limited English speaking. We provide them in a whole range of different ethnicities, Black African American population, Arab American, Korean, Chinese, and so forth. And then most area agencies in Illinois are also required to provide shelf-stable meals so that when bad weather hits here in Illinois, especially snowstorms or tornadoes or that kind of things, people still have shelf-stable meals to take advantage of. And then finally, we have a strong effort on farmers market coupons to be distributed to older adults. So that's the high level, and we'll go into a little bit of a detail on each of these. Next slide. So congregate meals, next slide, and that's one of our actual sites. So meals eaten at the site, we have a strong preference through our request for proposal process that additional social activities such as evidence-based health management programs are provided at each of the dining sites. And most of our dining sites are open between 11:30 and 1:30, but we have a couple that operate later in the day. Latinx sites seem to prefer a later lunch than some of the other general sites. So you could see here the variety in the ethnicity. We have sites that serve only Chinese, Korean, and South Asian older adults. We also provide medically tailored meals. Next slide. And so this link, when you get I think everybody will get the slide deck later, Chelsea or Hannah. Yes, they will. So you could click on this later. We really try to make it easy to find the most convenient dining site to an older person through this link on our website. Next slide. I think there's one more. So this gives you just a picture of the number of sites that we provide across suburban Cook County and a flyer that we distribute at all of our outreach events and all of our caregiver events. Next slide. So the home delivered meals program, and next slide, we'll go into just a little bit of detail on this one. The meals are provided throughout suburban Cook County with the exception of one very small county township where they have a private program that provides for the meals in that area and a very low population. So the home delivered meals, depending on the area and depending on the ethnicity, are provided either a hot meal along with a cold meal or frozen meals in some cases where it's harder for us to do the deliveries, and then medically tailored meals. And at times this is provided through Mom's Meals, but also, as you heard earlier, we have the meal box program, and we'll talk about that in more depth in a second. Next slide. So these are the eligibility guidelines that are just more in depth. I will tell you that we are tightening these up right now. Unfortunately, in the state of Illinois, we are now running about, we anticipate $25 million short of where we need to be to completely fund our program. So just a point of advocacy, we have been looking at how do we narrow down or tighten up these eligibility guidelines within our area, or look at priorities in terms of which people are most in need of meals. We have only about $13 million through the Federal Older Americans Act. We still have $63 million, which is incredible, through the state, but we need $25 million for the fiscal year starting next October. And so this is a stressor point with us. Next slide. So one of the beauties of the home delivered meals program and congregate dining is that we are able to serve caregivers in the form of spouses or caregivers for people who have disabilities under the program. And we do encourage that so that the caregiver and care recipient can get out and enjoy a meal at a congregate dining site, or have, if the meal is delivered, that they both get a meal and can dine together. Next slide. So this is another link that we have particularly designed to ease our relationship with managed care organizations in our area. And we have strengthened the relationships, and we do training sessions for care managers at the managed care organizations that are providing service through the dual eligibles or home and community-based services program in our area. And this really walks each of those case managers that already have a heavy workload through how to do a referral of somebody to a meals program. And you will get these later, so you could click on the link and see what that form looks like. Next slide. So meal kits are something that we started at the beginning of the pandemic. And next slide. And in our area, we happen to have a not-for-profit firm called Topbox. And our dietitian and their dietitians work together to develop healthy meal boxes that are delivered, as I mentioned, with menus and instructions or recipes for preparing the meals. And these are particularly heavy on fruits and fresh produce. Next slide. So the meal boxes, we have had them delivered on a weekly basis, and it's actually less expensive for us to deliver these 21 meals 3 days a week than the individual pre-prepared meals, because the meal boxes don't include the preparation costs. And then we have tailored the meals to do those 6 different menu styles below, as well as tweaking them to be more prescription type diets. And then when these people start receiving the meal boxes, they receive a shelf-stable meal first with some of the shelf-stable things that are required. Like in the case of the Latinx, they might receive cornmeal at the beginning of the cycle, or other more shelf-stable items that will last them through the first 6 months or so of the meal box deliveries. Next slide. Yeah, so particularly why refer for meal kits, and the managed care organizations, as well as our caregiver resource centers, get this guidance, and we do training sessions on this. So the meal kits also are preferred because they're fresh. The food in them can be tweaked seasoning wise to be tailored to the individual receiving the meals. So these are some of the other reasons here why this has been a popular program. I will tell you that we need to provide this program through the state funding that we received. The federal funding isn't flexible enough yet. We need to do pre-prepared meals for home delivered meals if we use the federal money, but since we have so much state money, the meal kits are a great option. Next slide. So older adults at risk of food security, from the data that we have received. In addition, when people are at risk of food security, here are some of the other most commonly referred programs that people go to. So you could see that companion services, sort of like respite. I mean, these respite and sitter or companion services are just one of the most popular things that we need, that caregivers, that the assessment turns out that caregivers need at the end of the day. Next slide. So here's more data from TCARE on the risk of food security and the impact of engagement. So you can see where the burden is decreased after TCARE assessment is done and the services are provided. So you see the improvement in the status according to all these burden levels. Next slide. I want to make sure we have time. I think this is our last slide, maybe. But I just wanted to highlight that our grandparents raising grandchildren and other relatives raising children has just been skyrocketing in our area due to a number of factors. And often older adults we would deliver a home delivered meal, and they would provide that meal to their grandkids rather than eat it themselves. In some cases, even to their pets. So just highlighting this is a really important factor to pay attention to, maybe in each area, but particularly our underserved communities have seen just high increases in this population. So I think that might be the last slide. So we still have time for questions. I sped through as quick as I could. Sorry if I went too fast on some of those.
That was terrific. Thank you so much to both Diane and Laura. So now we will take some time for questions and answers. Please feel free to drop any questions you have into the chat box. Give it another moment. Oh, go ahead.
Yes, Sherry, I see your question, and absolutely. That was one of the reasons on February the 24th, we held a press conference in Springfield, and we just have seen the need for meals skyrocket. I think just even as people are afraid that there are going to be SNAP benefits. So it's kind of been watching a slow train crash is the way I've described it, because people are seeing the cost of food increase, the cost of gas to go to the grocery store, all the costs are increasing right at the same time they're under threat of losing SNAP. And reapplying for those benefits is gotten very confusing for people. So absolutely, yes, it's been really, really had an impact.
Diane. We'll give it another moment for questions to come in, but in the meantime, I'd love to ask Diane, if another AAA director called you tomorrow and said, we want to strengthen our caregiver identification process, our screening process, what advice would you give them?
Um, I, um, I, I guess that when we looked at all the ways of assessing caregivers, we really wanted a tool that specifically focused on the caregiver versus the care recipient, which most assessment tools use, looking more at the recipient than the caregiver. And I think it's really important to look for a tool that really pinpoints exactly what interventions are going to move the needle to the greatest extent. And so after looking at a number of assessment tools, we honed in on the TCare tool. So for us, that was really a great solution. So I guess in general, in terms of structure, I would look for a tool that focuses on the caregiver, and an evidence-based tool would be really important to take a look at. So those would be, some of the things that I would take into consideration.
Thank you, Diane.
Yeah, I see there's a couple of other questions, and there's somebody who lives right here in Oak Park. So Denise, you would go to Oak Park Township and ask them to assess you for the meal box program. Oak Park Township Senior Services, Oak Park River Forest Senior Services is the caregiver resource center there, and also they do the assessment for the meals program.
Thanks, Diane. I see we also have a question here. How do you find the tool for getting assessed? And I think they're referring to the online tool that you mentioned, the link, Diane, that's available. They can click to access the screener.
So it is, yeah, it's right on Age Options website. And Denise, I will put my email in here. If you send me your information, I can send you a copy of the link later, because I'm not that great at being on the webinar and trying to find the link at the same time. So I'm putting my email in. Please send me an email later and I will, in a PDF. Great, Hannah, thank you. And then farmers market, yes, that is an issue. And we have transportation available in some of our areas. I know it's not everywhere. And the farmers market isn't nearly enough well-funded in order to provide all the coupons that we would like to provide.
We'll give it another moment for questions. Diane, I'll take another moment to ask you a question. What partnerships have you found as an area agency on aging that have been the most critical in making nutrition referrals successful?
Oh, every partnership, especially at Age Options, we've been working to better partner with healthcare providers and make information about our services available through emergency rooms and hospital discharge areas. We have been working way closer with managed care organizations and just making sure that our outreach efforts are as plentiful as possible at the community level. I have to put in a word. Just the other night, I watched an episode of The Pit, and if you haven't watched it, you people, everyone who's listening, it really has been focusing on caregiver issues as well as food security. The episode that I saw last night from the second season, the physician staff there was trying to keep somebody back because they had malnutrition. They were suffering from malnutrition, and they wanted to just keep them in the hospital just to get them back up to a decent state of having decent nutrition. So it's just really timely in terms of, I don't know if you've seen that, Chelsea, but it kind of interesting that it's so in the caregiving issues, and malnutrition has been so in the mainstream lately that it's really a nice thing for us to use as an advocacy base.
Absolutely. It's really nice to have that national spotlight and to bring it into the living rooms in that sense, to those that who may not otherwise be as familiar with the significant needs that older adults and older adult caregivers are facing in general and specifically as they relate to nutrition.
So if there's another second, I'm interested, Laura, so Pamela asks about changes in the federal food nutrition pyramid. And yes, at the state level, they have been taking the new guidelines into consideration, and we're working through trying to see how this would apply at the local level. And I just came back from a national meeting in Washington where the Administration for Community Living, Mary Lazar, who's the head of that agency, was really promoting the new MAHA meal guidelines. And Laura, I'm really interested in hearing what you all have to say about those.
Yeah, so I will say that we were very happy to see that they provided some older adult guidance, and that even though they inverted a food pyramid, that at its core, it is still promoting fruits and vegetables, whole grains, lean sources of protein. So I think it will probably cost extra money for OAA programs to implement the new guidelines, because I think it's going to call for a little bit more produce than the last version. And if it does, we need to know so that we can, advocate for more money so that we can provide healthier meals. So there was the risk that those were going to shock us, and I was really glad that they didn't.
Thanks for that question. Thanks, Laura. Well, we unfortunately are at the top of the hour, so the end of our session for today. Thank you both so much, Laura and Diane, for joining today. As it's been shared on this webinar, the slides and all links that were shared will be shared with everyone that attended today. And thank you to our presenters for sharing their email addresses here on the slide for any follow-up questions you may have. Thank you again for being such champions in the field and supporting older adult caregivers.
Thank you. Thanks for having us. We really appreciate it.
Thank you.
Take care.